All right, good morning. This is why you have a warm-up person, not me. Are we good? Okay, great. Good morning. I am Amy Brewer, the CEO of Sturdy Health, and it is an absolute honor to welcome you all here today. This is obviously an incredibly special day for Sturdy as we break ground on our new emergency department and behavioral health unit. Is someone?
Yes, that was right there.
It feels like just yesterday we were here breaking ground on our brand new cancer and specialty care building that is now scheduled to open in just a few short weeks. And we could not be more excited to provide this new access and excellence to our patients and our families in the region. I want to start by welcoming so many people that are here today. Our Attleboro Mayor Kathleen D. Simone, State Representatives Jim Hawkins and Adam Skalin, Senator Paul Feeney, Health Policy Commission Executive Director David Self, Health and Human Services Secretary Kiami Mahamia. Lieutenant Governor will be here shortly, Congressman Jake Auchincloss and Senator Ed Markey. We have been instrumental in driving change, advocating for health, for access and innovation, by the way, at a time where we need it more than ever. We are so honored to have your support, and we're so honored to have you here today. I'd also like to recognize our Board of Trustees who are here today and led by Donna Kimmel, our Board Chair, Tom Noel, the Chair of our Building Committee, Steve Berlone, the Chair of our Finance Committee, Kevin Cryan, the Chair of our Development Committee, and Ralph Schlenker, the President of our Foundation. So if we can just give a round for our board. We have an exceptional board here at Sturdy, and their guidance, oversight, and belief in this project and this organization have been invaluable, and our community is stronger because of their leadership. I also want to quickly thank our project team. Wayne will talk more about them, Consigli, Redgate, and MBBJ. It's like the literal dream team of construction, and we just feel so lucky to be partnered with you. To our generous donors, many of you are here today. We literally could not do this project without you, and your investment in this new emergency department will benefit our community for generations to come. To our dedicated police, fire, EMTs that are here today, you are there for our community members at often their worst times, and you are an incredible partner to us as we care for our community. I'd like to just quickly, they're all in the back, but I just want to thank our police and fire for being here. To our Sturdy physicians, nurses, clinicians, and staff that are here today, you are the reason that we are here. You serve with skill, compassion, and resilience, often in space that has not matched your excellence. And this facility is for you and because of you. And we hope this new modern facility helps make your really difficult job a little bit easier. I would just end by saying, like, the reality is we don't spend our days thinking about the local emergency department until you need it. And when you need it, you need to be ready, and you need it to be excellent, and that is what we are building. And it's just an honor to be part of it. And with that, it is my pleasure to introduce someone whose leadership and incredible generosity helped bring this project to life, our Board Chair, Donna Kimmel.
Thank you, Amy. It's an honor to be here with all of you. Thank you so much. As a longtime member of Sturdy's board and now as board chair, I've had the privilege of being involved in many meaningful initiatives with Sturdy Health. But today is different. Today is truly transformational. It's not just a construction milestone. It's a part of continuing our promise to the community to provide compassionate, high-quality emergency care for every person in need, and to ensure that no one faces a crisis without support. It's also personal for me. Over the years, my mom and I have used the emergency department numerous times, And every time, regardless of the hour or the urgency, we walk away feeling seen, feeling heard, feeling cared for, and quite grateful. Now you might be thinking, yeah, right, she can say that she's board chair. But the reality is, no one knows who I am. And that's perfectly fine, especially at 2 a.m. But it really doesn't matter, because one of the things that's so great about Sturdy is that every patient, every single human being gets cared for at Sturdy in the same careful, compassionate way. That truly is the Sturdy difference. It's in that spirit and the heart of this emergency department. The space is truly being built for the future, with input from staff, from the community leaders, and from our government partners. I'm proud to say that this project will deliver equitable, high-quality care for everyone in our community in a space that is definitely going to be respected and supportive of all of our community members. Thank you to all of you who have made this day possible and this moment possible. We are truly grateful. And now I'd like to welcome our Executive Vice President and Chief Operating Officer, Wayne Dietz, to share more about the project and the day-to-day operations.
Thank you, Donna, and welcome everybody. I want to echo my deep appreciation for all that made this project possible today. From our design and construction partners, to our city and state officials, to our donors and community advocates. This is your project too, and we are very excited and proud to build it with you. I know Amy already mentioned some of the construction folks, but again, we have to call them out. They've been our partners for almost 3 years now, and will be our partners for an additional 3 years as we build out this project. So from the Consigli team, we have Stephanie O'Brien, Brian Young, and Morris Smith, and the entire team from Consigli. From Redgate, we've got Christy Dow, Jennifer Southerby, and the entire team from Redgate. And from MBDJ, we've got Quan Lee and his amazing team of architects. You've all been excellent partners and we look forward to the next 2.5-year journey with you. And thank you to our Sturdy team, including the facilities and IT teams who have kept us running during all this as we continue to grow the campus. The emergency department is a major step forward in how we deliver care. The current ED was built in 1970 when volume, acuity, and complexity were nowhere near where they are today. Our staff have made the most of every square inch of the space we have, and it is truly time to build something new and special. Today we break ground on more than bricks and mortars. We break ground on a bold $113 million commitment to modern, compassionate emergency care for our patients in Southeast Mass and those experiencing behavioral health crisis, of which I think we all know is on the rise. This 38,000 square foot facility will feature 50 private rooms, 2 advanced trauma bays, rapid triage zones, on-site CT and imaging, and a dedicated 12-bed behavioral health unit designed specifically to meet the mental health needs of our region in a calm, dignified setting. As far as what this building will mean for us day to day, our ED staff, which a lot of them are here with us today, they are extraordinary healthcare workers who treat every patient regardless of who they are with compassion and excellence. This project reflects our commitment to grow with our community and to meet the changing needs while providing both our patients and our staff with the space they need and deserve. This facility will give our patients a modern, healing environment and our clinicians the space and tools to do their best work. I want to thank all of you, our community, for our patience during this construction. We know it hasn't been easy, but we're building something that will serve us all for decades to come. And now it's my pleasure to introduce one of many leaders who have helped advocate to make this vision a reality, our good friend and mayor, Kathy DeSimone.
Thank you, Wayne. Thank you. Good morning. Welcome to Attleboro on this beautiful day, but I dare say that every day is a beautiful day in the city of Attleboro. And as I stand here, I'm happy and excited and jealous because, as any government official will tell you, we could not get this done nearly as quickly as Sturdy is making this happen. Every day when I drive home from work, there's a building up or a building's down. That doesn't happen in the government sector, so I'm a little bit jealous. I'm also honored to be here today, of course, to celebrate the groundbreaking of what will become Sturdy's new state-of-the-art emergency department and behavioral health unit. As mayor, a longtime resident of Attleboro, I am ever grateful for Sturdy's ongoing dedication to providing exceptional health care and its deep commitment to meeting the increasing needs of our community. My connection is also personal. My 2 kids were born here. My friends and neighbors work here. My doctor is on the Sturdy staff. And like many folks gathered here today, my connections are strong and deep to Sturdy. As some of you may know, I'll tell the story nonetheless. Sturdy Health and the City of Attleboro have a long and well-established history together. It started in 1911 when the property you see before you was bequeathed by Ellen Windsor to the city to create a hospital. 2 years later, Sturdy opened its doors and embraced area residents with great care, and countless thousands and thousands of people have walked through those doors every day since. Of course, Sturdy is special for other reasons. As a community hospital, Sturdy provides valuable contributions to our healthcare system, including convenient access to healthcare services, serving a large proportion of low-income and underrepresented patients, and particularly providing high-quality healthcare to all who seek their help. As the largest employer in the city, Sturdy staff frequent our local businesses and support our community organizations. Sturdy Hospital plays a part in our community of care. They offer public education and healthcare screenings and partner with our schools and other local healthcare organizations to ensure a healthier community for all. Sturdy has a true commitment to providing community healthcare with compassion and respect. The staff of healthcare professionals here are deeply connected to the community, and they are supported in their work by a dedicated governing board of directors, many of whom I know are local residents, physicians, community and business leaders who work together to support the well-being of Sturdy and our community. Of course, like other community hospitals, Sturdy faces substantial challenges at the moment: increased costs, changes in health insurance coverage, staffing shortages, and the increasing number of large profit-based healthcare provider conglomerates. But in the face of these challenges, Sturdy has only strengthened and doubled down on its commitment to quality healthcare to the community. They're expanding their services and programs and continue to invest in the staff in the Attleboro area and beyond. For all these reasons and more, I look forward to celebrating today's groundbreaking and another 100 years, Amy, of partnership, service, and community. And now, my friends, it is my distinct honor to introduce someone who was a mayor, who totally gets where I'm coming from, and was a heck of a mayor, dare I say. It is my honor to introduce to you the Honorable Lieutenant Governor of the state of Massachusetts, Kim Driscoll.
How about that for your mayor? Excellent job, and really grateful to be here in Attleboro with you, Mayor, with so many members of the Sturdy team for this investment in healthcare. I'm joined by our Health and Human Service Secretary, Kiami Mahania. So grateful to have you here, a physician who is still practicing at least one day a week that we let you out of the office and understands deeply the commitment to healthcare and what it means to be here today, to be groundbreaking, celebrating this new building. Always grateful to be here with you, Senator Markey. We were together yesterday. I don't know where we're going tomorrow, but I look forward to it. And obviously, Congressman Auchincloss, terrific to have you here and to be able to work with our members of our delegation, including Rep. Hawkins, Senator Feeney, and so many others who are here. Grateful for the opportunity to work with all of you, Representative Scanlon as well. It is a partnership in Massachusetts that allows us to brag about being number one in healthcare, number one in education, number one in innovation, and it's this distinct community gathering and collective action that enables us to celebrate days like today. So congratulations to the whole team here at Sturdy on today's groundbreaking, on not just a new building, but a real commitment to care, to the community, to the region, to caring about each other, our neighbors, in a meaningful way. It is not easy to put together all of the nickels and brain power and logistics that go with building new facilities in healthcare. It's a tough environment in healthcare right now. We know that. That's all the more reason for us to step up and partner together. We believe strongly in the power of collective action in Massachusetts. It's key to our history and it's key to our strengths. We like to refer to it as Team Massachusetts. I'm wearing my Team Massachusetts bracelet. And this idea that none of us are as smart as all of us. When we put heads together and work on tough problems, there's nothing that can stand in our way. We are the state that makes the impossible possible. We've got hardworking people every single day who bring that to bear. I'm happy to celebrate today with you this milestone that comes on top of another milestone with a new cancer treatment building. I have to say, healthcare, accessible healthcare, high quality healthcare, that's our calling card. Those are the issues that we care about. And this is the ability of partnerships to deliver. This is really more than about a building. The emotional connections that we have, those of us who are leaders in our community, to our healthcare facilities, the mayor just pointed it out, from children being born to opportunities to ensure that we're supporting quality preventative health care, working hard to have a facility that ends up being the place you go on your worst day and come out on your best day. That's what hospitals mean to regions and to the many of us who are fortunate to live in a state that does it at the highest quality possible. I was talking with a colleague of mine from another state who told me we have one good hospital in our entire state and that's where you go. That is never the experience anyone in Massachusetts has. And we work hard to ensure that no matter where you live, what region, you have access to care. And it doesn't happen unless we have sturdies who make that investment. Preventative care, behavioral care, emergency care, cancer treatment. Folks who live in this community know that they, in this region, know that they have an incredible partner. That happens when we come together, celebrate days like today. I'm so grateful to be able to make sure that Massachusetts as a state is doing all that we can to bring this to bear, supporting this project, to high quality healthcare access in this region, and the team that you have put together to ensure that happens. And I just want to really recognize and call out the innovation and the ingenuity and the commitment to care that exists here. And it doesn't happen everywhere. It's because we believe in science, we support education, we believe in the role of government to partner to carry out important missions like this. And that's what not only makes Massachusetts different, that's what makes it a difference in this region, in this community. So happy to be here to celebrate with all of you. Congratulations on such great work. And it's my pleasure to introduce our partner leading our health and human services efforts in Massachusetts. It is not easy to be in healthcare. It is not easy to be working in human services right now, but nobody's going to do it better than Massachusetts. Our Secretary of Health and Human Services, Keyame Mahania.
Thank you, LG. Very honored to be here. As many of you know, this is my third week in the job. And so it's been a very steep learning curve. So one more thing I've learned today is don't go after the LG because you're not going to be able to meet her inspiring words. So that's the lesson. And for Sturdy, you guys are actually my first groundbreaking ceremony. So you'll live forever in my memory in terms of being a hospital. So just a few comments. Like the speakers before me, I want to emphasize just how important community hospitals are. As many of you know, I work in a community health center, and we've always been associated with local hospitals. And that link that the hospitals have with the community is incredibly crucial, particularly when you're looking at public health. And one message that I would have for people in Attleboro is we all love our local hospitals. And you can see the heartache that people have in their communities when their local hospitals either get smaller or close. So the one big message I have for people in Attleboro is if you value your hospital, use it. We are blessed, like the Lieutenant Governor said, we are blessed with world-class institutions here in Massachusetts. But it doesn't mean that all your care has to be in Boston. If you have an excellent local community hospital, use it. Because as the mayor mentioned, the financial pressures on local community hospitals are incredible. And they need your business, they need you to seek them as experts in the care that they provide. I'm very excited to see a community hospital that is doing well, that is growing, that is facing the future. And for that, I'm very excited to be here. And I would be remiss if I didn't point out my good colleague, Cynthia Sierra, who's from the Community Health Center, which I'm sure is a very close partner to the hospital. really firmly believe that Attleboro and the hospital, Sturdy Hospital, has a bright future ahead of them. Thank you.
Thank you so much for being here, Secretary. I didn't realize we were your first groundbreaking, so we really, when you and your team RSVP'd, yes, I was like, wow, he's only been in this role 3 weeks, but we really appreciate you taking the time to come down here. It is now my honor to introduce somebody who has been a steadfast advocate for Sturdy and for the well-being of our entire region.
Thank you. This is an honor, and I won't lose your place in the book. This is an honor to be here. I only represent Attleboro, and I can say from the community, everybody is very proud of what's going on at Sturdy. For a long time, it's been very stable, a good place to work, no big turnover with health. That doesn't happen everywhere. But in a sea of bad news in the region, we're very lucky. We are very lucky to have Sturdy. If we think about cancer is becoming more and more prevalent, and we're adding a cancer center. All I hear about is the shortage of emergency room beds across the state, and we're adding emergency rooms. So I am very proud to be here. Our community is very proud of your work, and I'm looking at everybody here. And it's not a surprise that you're able to fill the front row with dignitaries from every level of government. Other people recognize this as well. It's my honor to introduce Congressman Jake Auchincloss, who has worked very hard to support us in all of this in the community and the hospital as well. So thank you so much.
Good morning. It's such a pleasure to be here, and so refreshing to hear the Lieutenant Governor talking about Team Massachusetts and how all of us are smarter than one of us. Kim, that's not my experience in Congress, I will tell you. I feel like we get dumber as the group gets bigger sometimes. And the latest challenge we're dealing with in Washington is, on the committee on which I serve, which has jurisdiction over health care, they're passing the biggest cuts to health care in a generation. Arguably the biggest cuts to health care in American history since the Great Society. Too many in Washington think this is waste, fraud, and abuse. They think that offering dignified, expedient treatment to those in crisis, to ensuring high-quality care, to preventing workplace violence against our nurses and physicians is somehow something we can't afford. And we here in Massachusetts know that's not the case. And what's happening over there is going to be vitally important to the patients of tomorrow, to the providers of tomorrow. But to me, even more impactfully, what's happening in here is going to be critical, because we have challenges ahead of us in healthcare here in Massachusetts. These Medicaid cuts are significant. They're going to take billions out of the budget year over year. And it's going to be the people in this room. It's going to be our first responders. It's going to be our healthcare practitioners. It's going to be the patients. It's going to be our state officials and our federal delegation working in tandem to do what Massachusetts has always done best, which is to innovate under pressure, to deliver superior, dignified healthcare. I've got great confidence that we can do it, and I look forward to doing it with all of you.
We're going to hand it over to you.
Good morning, everybody. Come on, what a day to be out here in Attleboro, huh? I want to thank you, Mayor. Every time I'm here, you get the beautiful weather, right? You take care of us. It's good. Everybody up here has been thanked, but I do want to just state one more time how important it is to bring everybody together from different levels of government, from different sectors, from the healthcare sector in its entirety, for such a project like this. We don't see this everywhere across the Commonwealth. We should see it more. But here in Attleboro, we're doing it right. And it's because of the leadership here at Sturdy, in particular, Amy. Thank you, thank you, thank you, not only for what you do. Amy, you and your board, I just want to thank you not only for what you do every day, not only for what you're doing here, but for being who you are, for understanding what we need in our region, in our Commonwealth. Like I said, that doesn't happen everywhere. And we're blessed here in Sturdy to have such forward-thinking, visionary, bold leaders like Amy and the board here at Sturdy, and everybody in this community who supports them. To our secretary, thank you for being here. Welcome. You're going to get used to having shovels and hard hats in the office, so make sure you clear out a spot for that. To our Lieutenant Governor, who I got to tell you, Lieutenant Governor Driscoll, we know she comes from municipal government, but she spends more time, I think, in Attleboro and in this region. Mary, you may want to send her a tax bill this year. She's been here so many times. She is everywhere. She is supportive of everything that's happening in this region. For that, we are truly blessed. I want to bring up our next speaker, but before I do that, I just want to shout out to all the providers. We celebrate today. We're going to celebrate the groundbreaking for 4 Walls in a new building, but it is important to remember that it's the people inside that building, the people that are providing that care to folks on their worst day here in Attleboro and up through this region, the people who do it with empathy. Maya Angelou always said, right, people won't always remember what you said, they won't always remember what you did, they'll always remember how you made them feel. As somebody who has had to come through that emergency room once, I will tell you that I always feel cared for, I always feel listened to, and that's because of the providers in this building. And I know that will continue. So I just want to give a shout out, especially to the nurses. Do we have any nurses? Can you raise your hand in the crowd? We know that in the United States of America, people say the healthcare system is broken. Our health insurance system is broken in the United States of America. Our healthcare system is second to none here in the Commonwealth of Massachusetts. It's because of our nurses. And a final shout out to all of our public safety officials back there too. I see many chiefs from the area that are here. They are the ones in all hours of the day and night that are coming to Sturdy to drop off patients, and the work that they do is valuable, and we really, really appreciate them. I want to bring up our next speaker, somebody who is a champion not only of Sturdy Hospital, but of our community health. I see Cynthia out there, I know you will agree, of community health, who gets it, who's a champion of people across the Commonwealth. We are so lucky when we see what's happening down in the United States, in the United States Congress, to have folks like our delegation. You just heard from Congressman Ockcloss. And now our next speaker, United States Senator Ed Markey, who gets it, who truly gets it. And we are proud to have him with us today. We are proud to have him as a champion of Sturdy. Please give a warm welcome to the United States Senator from Massachusetts, Ed Markey.
Thank you, Paul. Thank you, Paul, and thank you for being a voice for all of the people every day. That is what you do. That is who you are. And it's great to be here with you, Lieutenant Governor. Salem yesterday, we were just trailing each other around the state. Mr. Secretary, congratulations on your new job. And Madam Mayor, great job. Great job. Jim Hawkins, and to Donna, and to your great work as well. And to my partner in the United States Congress, Jake Ockcloss. We work down there every single day to fight against this crazy war against health care that the Republican Party is waging in order to have larger tax breaks for billionaires and millionaires in our country. And it is absolutely unconscionable what that plan is. And also to be here with somebody who is like a one-name person, like Cher or Beyonce, Amy, just a one-name person now. You just say her name in Attleboro, and this whole region, and everyone knows who you are talking about. So we thank you so much for everything that you are doing, because today's celebration is also a declaration of our commitment to the promise of high-quality, affordable health care for everyone. Today is a declaration of hope that the future here in Attleboro for health care will be better than the 20th century, better than the 19th century. Life expectancy was 48 years of age, a little more than 100 years ago. And then we began the interventions for every single family. And now we've extended it out to actually 79 years of age. We've added 31 bonus years of life because of community hospitals, like what happens here in Attleboro, and Medicare, and Medicaid, and vaccines. Can we hear it for vaccines, everybody? Yeah, it's absolutely critical. And it's an honor to be here with you today to break ground. This hospital has been the cornerstone for over a century. It has been serving generations of local families with compassion and dignity and expert care. And today, we celebrate building on that great legacy. This new emergency department will mean more beds, more access, and above all, more hope. More hope for everyone in the community. And the Sturdy Hospital is absolutely well named. Huh? It's just the building block of the entire community. Now, behavioral health is at the center of what is going to be happening here. And my wife was the chief of behavioral medicine at the National Institutes of Health, and a 2-star admiral in the Public Health Service of the United States. So I've been getting the lecture on behavioral health every night for 40 years. Every night. About how central it is to have a capacity to intervene, to help people with mental health issues. And that's what you're about to do. You're about to expand that capacity as we see an increase in mental health issues for teenagers, for children, and adults. Not just here, but across the whole country. And this is just an incredible, incredible commitment which you are making. And I was proud to work with Senator Warren and with Congressman Auchincloss to include the funding that we were able to put in the appropriations legislation in order to help Sturdy be able to realize its vision. And that's what it's all about. Our partnership in Washington and your partnership here to ensure that everyone gets the health care which they need. The great Massachusetts poet Ralph Waldo Emerson said that health is the first wealth, and we cannot allow it to be looted for the wealth of the wealthiest in our country. These cuts that the Republicans just voted for, $900 billion out of Medicaid, $500 billion out of Medicare, $300 billion out of the Affordable Care Act, $250 billion out of SNAP, out of food programs to help with the ensuring that nutrition is a big part of every family, whether or not they can afford it. So we saw what happened when the Stewart Health System decided to loot those hospitals, and what then happened to those communities. It's just the opposite of what's happening here in Attleboro. There's an investment in the future, investment in families, investment in young people. And that's what makes today so exciting. It is to ensure that everyone is going to receive first-class health care right here in the community. They don't have to go to Boston. They don't have to go to Providence. They can stay right here and get that high-quality health care. The emergency room, when I was run over when I was 5 years old, that ride into the emergency room was unbelievable. It was unbelievable. It's one of the most memorable experiences that you could ever have. And I was only 5 years old chasing Charlie Cadero and Bobby Olson, who were 9 years old, like 2 streets away. And there's one thing when you're in the emergency room that your mother tells you. First of all, if you're in an accident, give them your phone number. And make sure, Eddie, that you change your underpants every day, because I'll be so embarrassed if the doctors ever see you, with those underpants. So, of course, I haven't changed them for 5 days. So I'm only 5 years old. But that emergency room experience just stays in your brain. And that's what you're providing here. You're providing that extra level of quality and health care. It's a declaration of hope for the city of Attleboro. So I very much appreciate the dedication, the commitment which you're making, and all I can promise you is that I am going to do everything I can to to reverse those cuts, because it is Medicare, it is Medicaid, it is the Affordable Care Act that pays the bills, that keeps the hospital going. And we just have to make sure that we restore those cuts so that this vision of a better 21st century is something that can be realized for every single family in the community. So I thank you all, and congratulations to everyone on this incredibly glorious day for Attleboro. And Amy, back over to you. Thank you all so much.
We have something for you. You have been, as you just described, an absolute advocate and champion for us and for such needed funding to make this project a reality. We would not be here today if it were not for you and Senator Warren and Congressman Auchincloss. And, well, but it wasn't your money, but you still helped. You still had to support the project and be part of it, and just everyone who's here today. And so we are honored to present with you the Legislative Champion Award from Sturdy Health for your advocacy, dedication to our organization and our community. Thank you.
Thank you so much.
And now we're almost done. I'm so happy that the weather cooperated and we're not all passing out. But it is an absolute honor to honestly introduce somebody who needs no introduction. And again, sort of the reason we're here, our Chief of Emergency Medicine, Dr. Vanessa Mutuno.
Thank you for everybody being here. It's so wonderful to be sharing this tent with you. There's a lot of love under this tent in this parking lot, and I've had one of the greatest seats here, I think, because I've been watching our patients coming into our emergency department, which they do 24/7, and we provide excellent care 24/7 for those patients, and we thank them for entrusting their lives and their care with us. I'd also like to thank all of our supporters who are in the audience today, who are really dedicated to the nuts and bolts of making the healthcare system work. We really appreciate the work that you do, because without you, we really wouldn't be able to forward our mission. I'd also like to just point out again the EMS crews who revisit Sturdy over and over again, providing very professional and excellent care for our patients in the pre-hospital setting. Without them, we would not have the quality that we have in this community, and the level of quality that we provide is so contingent upon the first-line responders, so thank you. And also, please forgive me if I smile too much, because my muscles are aching in my face, because this is so wonderful to be here today. My muscles are aching, and Alyssa Jolliker, who's in the back there, our ED director, is also aching right now. We're going to be taking a lot of pictures later outside, so a lot of selfies in our future. I can tell you that this is a special moment in our history at Sturdy. The emergency department, as you all know, is where patients come in their moments of great need, the moments of uncertainty when they fear the most, and in their dire moments. And the demand for our services continues to grow year after year. To give you some examples, back in 2004, we had just over 43,000 visits to our emergency department a year. And now, last year in 2024, we surpassed 52,000 visits. And I think it was mentioned, our emergency department was designed in 1970. In 1970, we designed it with 31 beds. We have 1 trauma bay and just 5 behavioral health spaces. And guess what? These nurses who are sitting here in our audience can tell you over and over again that we've been working since then with the same resources, and we've been doing an excellent job with what we have, because that's who we are. And thanks to our modern leadership and the commitment to reinvesting in ourselves and our community, we're now moving into a space where we're going to have nearly double the space. So we're going to move into a 38,000 square foot facility, which is going to double our space, and we're going to have at our disposal a huge amount of resource and 2 trauma bays, a secure behavioral health wing to provide our care. When our current emergency department was designed, we had shared rooms, curtained off beds that we sometimes have to provide care in the hallways just because the demand is so great. And really, if you think about it, we appreciate the kind words for those who have come through our emergency department and other emergency departments, but really it's not fair to our patients to have that sort of environment. We can have excellent care, but you should have an excellent environment to provide that care. And we're doing that now. And our staff is no longer going to have to bump into each other, caring for patients, squeeze by each other, and do those things that we've had to get by. We're now going to have private areas for our patients that they deserve, and give them the care and dignity that they deserve. The future of emergency medicine at Sturdy Health is very bright. It's bright as the sunlight you see right here, and we're going to have wonderful new windows in our new emergency department. The sunlight passing through that is going to be brightly shining on our patients, and we appreciate that we have this moment in the sun with you all today. We want to thank you for being here as we break ground and give us the support that you've given us over the years. Thank you so much for that. Our final speaker brings a clinical perspective on how emergency department impacts our patient care. And I'm very proud to present Dr. Brian Patel, who's been my mentor here at Sturdy and has been a huge support for the current program that we're about to embark upon and many others. Dr. Patel is our Chief Medical and Quality Officer. He's been a key voice in helping shape the design of our new facility and ensuring that it reflects both the science and the heart of medicine. Please join me in thanking and welcoming. Good morning, everyone.
Good morning, everyone. Thank you, Dr. Van Ness. This is truly an amazing day. I actually celebrated my 20th year at Sturdy a week ago, and I have had the pleasure of working in our emergency department, leading our emergency department, leading the clinical services here at Sturdy Health, and I cannot be more proud of everybody that works here each and every day. We could not do what we do without everybody that works here at this organization. I want to echo my thanks to everyone that's here today from the legislative delegation. We at Sturdy Health have a commitment here of providing equitable, convenient, high-quality access to all of our patients in our community. And what has been echoed here about community hospitals, I cannot echo enough. We need community hospitals in our communities, and they need to stay in our communities. And the only way we can do that is to have people use our hospitals and continue to do what we're doing here today, is growing our community hospitals, providing our patients the services that they can get here locally. They don't have to go to Boston to get all of these things. We do it here really well, and we'll continue to do it here really well, but we cannot do it without all of the support of all of you with everything that we're doing. From a clinical perspective, this new emergency department will elevate the way we care for every patient who comes through our doors. Our goal is not to just provide the highest quality care to all of our patients, but to do so in an environment and with the right tools to allow us to do so. First, as has been mentioned, our dedicated behavioral health unit will offer a safe, calm, and therapeutic environment, separate from our general emergency department. It improves the experience for behavioral health and medical patients alike. It is completely transformative from what we have right now, which is a 5-bed small area right in the middle of our emergency department. It is not benefiting anybody. And I think all of our staff is the most excited about having a separate healing environment for those patients who need it the most. Second, every treatment room will be private, offering patients and families the comfort and confidentiality they deserve, and our providers the ability to deliver this care in a more ideal setting. Third, with embedded CT and X-ray, we can deliver faster diagnostics right where they're needed, reducing delays and improving outcomes for all of our patients. And finally, our new care team workspaces will promote communication and collaboration, bringing our clinical staff together to work more efficiently and more effectively. And I think our staff that work in our current emergency department every day can attest that as much as we love being right on top of each other and working really closely together, this new space will allow us to do it in a much more efficient and effective way for our patients. This new emergency department is built around the people who need us the most and the people who care for them. That's what makes it so special, and that is why we do what we do. Thank you all for being here and for believing in what we're building together. Now, as a finale to our event, I'd like to invite today's speakers for the ceremonial turning of the soil as we officially launch this exciting new chapter for Sturdy Health. Thank you.